The start of the 20th century, mental health care was dominated by asylums, which were often overcrowded and under-resourced. Treatments during this era were largely experimental and sometimes controversial. Psychoanalysis, led by Sigmund Freud, gained popularity, focusing on exploring the unconscious mind. Alongside this, biological treatments such as shock therapy, insulin coma therapy, and electroconvulsive therapy (ECT) were introduced. Unfortunately, the 1930s and 1940s also saw the rise of lobotomies, a procedure that caused significant harm and sparked widespread debate. The conditions in asylums and the use of these invasive treatments highlighted the urgent need for better approaches to mental health care. The period from 1950 to 1980 marked a turning point in mental health care. The introduction of psychiatric medications, including antipsychotics, antidepressants, and anti-anxiety drugs, revolutionized treatment. These advances led to the deinstitutionalization movement, which closed many asylums and shifted care to community-based settings. Patients began to receive support closer to home, with an emphasis on integration and rehabilitation. Psychotherapy, such as cognitive behavioral therapy (CBT), also emerged, focusing on changing thought patterns and behaviors. This era laid the groundwork for more humane and effective mental health care, moving away from the isolation of large institutions. 1980 to 2000, mental health care continued to evolve rapidly. The introduction of the DSM-I diagnostic system brought standardized criteria for mental health conditions, improving diagnosis and treatment. Medications like SSRIs transformed the management of depression, while the official recognition of PTSD expanded research into trauma. During this time, mental health advocacy gained momentum, helping to reduce stigma and raise public awareness. Society began to view psychological well-being as an essential part of overall health, and support networks for those affected by mental illness grew stronger. Since 2000, our understanding of mental health has become more holistic, embracing the biopsychosocial model. This approach considers genetics, brain chemistry, emotions, trauma, and environmental factors. Advances in neurobiology and trauma research have deepened our knowledge, while digital therapy, telehealth, and mental health apps have made care more accessible than ever before. Despite these advances, challenges remain, including rising mental health issues among youth, unequal access to care, and persistent stigma. The journey of mental health care continues, shaped by both scientific progress and ongoing social change.